Abused and brain injured. Common signs and symptoms of traumatic brain injury. Research suggests that up to 75% of women survivors of IPV have possible traumatic brain injury, or TBI. TBI is an alteration in brain function or other evidence of brain pathology caused by an external force, and you do not need to lose consciousness for it to happen. You can also get a brain injury if your blood and oxygen supply to the brain are stopped by choking or strangulation. TBI can cause a number of signs and symptoms as well as debilitating long-term effects. How do we recognize TBI among women survivors? It is important to remember that every injury is unique and no two injuries will be the same. Each person can experience a variety of signs and symptoms. The purpose of this video is to introduce some of the more common symptoms to look out for. The symptoms of TBI often fall into four categories: physical challenges, sleep disturbances, cognitive challenges, and psychological challenges. First, TBI can lead to physical symptoms that affect various areas of the body and that can change or persist over time. Headaches and chronic fatigue are some of the most commonly reported symptoms, but lots of people also experience difficulty with their vision or hearing too. Second, some survivors of IPV and TBI may also struggle with sleep, sleeping more than usual, less than usual, or having trouble falling asleep. This may result in tiredness, particularly in situations requiring mental effort, reduced tolerance and coping ability, and irritability. Third, TBI is often accompanied by cognitive challenges, which are signs and symptoms related to thinking, remembering, or communicating. Survivors who experience these challenges may have difficulty learning new things, struggle to maintain concentration, take longer to complete tasks, and forget information communicated to them such as names, appointments, or safety plans. They may have trouble remembering important details when providing information, or it may come out in a mixed-up order instead of in a chronological or linear pattern. This is often misinterpreted as a woman making things up or changing her story, and it is important to realize that this could be related to a brain injury instead. Fourth, survivors may experience psychological challenges or signs and symptoms related to mental health, emotions, mood, or behavior. Many survivors experience feeling sad or anxious. Often people describe feeling angry and having a hard time controlling their emotions. Some survivors experience personality changes, saying they don't feel like themselves anymore or that they are a stranger to themselves. It is also important to know that many survivors of IPV-related TBI will also experience post-traumatic stress disorder, or PTSD, at the same time. Survivors who experience these challenges may also experience sudden changes in mood, exhibit verbal and physical outbursts, or impulsive behavior, have lower confidence and initiative, and experience symptoms of anxiety or depression, such as feeling hopeless or withdrawing from others. It is recommended that a person with a TBI should see a medical doctor or nurse practitioner as soon as it is safe to do so. It is important that healthcare providers adequately support survivors to manage, if not prevent, the potential debilitating long-term effects of TBI. It is also important to note the following red flag symptoms that warrant immediate medical attention. If you or someone you know has recently experienced injury to their head, face, or neck, and is experiencing any of these symptoms, it is important to seek immediate medical attention as they can indicate a serious injury potentially causing severe illness or even death. For more detailed information on these common signs and symptoms and their potential impact, please visit the Abused and Brain Injured Toolkit. It is important to remember that even if the injury happened a long time ago, we can still support survivors. Many women shared their experiences to help make the toolkit. They spoke about how service providers can make a difference by helping to recognize a traumatic brain injury and understanding how to accommodate it. These are their words. So, to make them aware of what the signs are and then how to broach, have you had a concussion or were you hit in the head, And then make the referrals, because that's the biggest thing. It's getting the referrals to people who can help them. And I'm not saying that family doctors wouldn't want to help. I'm not saying that at all. I'm saying they're not it's not a focus, and I think they would be surprised at how many women it does affect and how many of their patients probably are affected. I ended up with headaches at one point for 5 years, and they developed finally into constant migraines. So I've suffered with them for the last 45 years, something like that. So, I mean, dealing with the stress and the physical and mental impact, when you go to work the next day, you're trying, and it's hard to function. You keep trying to put it back in your head, but it does slow your brain down as far as being able to cope with what you need to deal with at work. And I thought, if I hadn't had the tools, or the brains, or the knowledge, or the resources I had, I would have been so defeated. I would have felt so defeated with so much more of the process and everything else. Honestly, the health system was so much more incredible. The community-based system was so much more incredible and supportive and just actually met my needs and listened to me. The research team would like to thank all the participants who shared their knowledge and expertise with us so we could begin to understand the intersection of traumatic brain injury and intimate partner violence.